Danielle, thank you so much for being here today.
Yeah, thank you for having me. I'm really excited.
I follow all the work that you do online, and it's really amazing. I think you're doing such a wonderful job at talking about what life after a diagnosis of breast cancer looks like, and not just sunshine, but the positives and the sometimes negatives and the challenges. So I'd love to hear about all of that, but let's start by just telling us who you are, what you do, a little bit of your story.
Yeah, so my name's Danielle. I also go by Dani because that is a funny part of my story is when I started talking about my journey, and I'll recap all of that in a second. But when I started talking about it, it was back 8 years ago, which is kind of crazy to say. It feels like so much time has passed, but also not a lot of time. But Instagram didn't have really long handles, and my full name is long. So I shortened everything, and now I feel like I kind of have this like nickname within the cancer community as Dani, and I love it. So that is like I go by both Dani or Danielle. It's kind of both. But I was diagnosed when I was 30 years old. I was diagnosed with breast cancer, invasive ductal carcinoma, and I didn't have any sort of family history. I had no means to be on the lookout for anything like cancer related. I thought I was living a relatively healthy life. I was really active. I was eating well, like all these things that kind of, you hear is the way to prevent or whatnot. And I use air quotes on prevent because that's a weird word. But I remember the day like so specifically and like it was yesterday, but I found a lump in my right breast. I had had this like really weird pain that full day leading up to when I did a self-exam. And it's really hard to explain. It was kind of electric in the way that the pain presented. It wasn't something I've ever felt before. And I thought I hurt myself, honestly, because I had done a workout class the night before. And I was like, maybe I just pulled like a weird muscle or something. So I did a self-exam more in a way of massaging, and that's when I felt this really hard lump. It didn't move. It was really uneven. And I just immediately was like, I got to get this checked. So I booked an appointment with my gynecologist, and went in, and I was immediately told, yeah, we feel something, but you're so young. It's probably nothing. Do you want to get imaging? Do you want to move forward with looking into this further, or do you want to wait? And that struck me because I was like, why are you even asking me this question? I feel like we should just be going forward and ruling it out or figuring if it's something we have to take care of. So I opted in to do imaging. So that week, I really advocated for myself. I got an appointment right away to get an ultrasound. In that ultrasound appointment, the technologist, I was really grateful that she was also a breast cancer survivor. So she pulled me aside and was like, we've got to biopsy this. So she advocated for me in this way that I never really expected. And then I went into a biopsy. And then that same week, within all these tests, I was told that I had breast cancer. And the first thing the radiologist asked me was like, do you have a history of this in your family? And of course I said no, because we didn't. And that was when I knew she was going to drop the "this is cancer" bomb on me. And when I heard the words, everything just like went black and I couldn't see anything in the future. I couldn't see anything in the present. I was just kind of numb and so overwhelmed and shocked by that diagnosis. So yeah, that's a little bit of my story. And this happened 8 years ago, almost 9 years. It'll be 9 years in October, which is again wild to say, but yeah.
How do you move forward from that moment? So you're getting this news. I think so many people find themselves so paralyzed in that moment. What do you do? Where do you go? Who do you call? What were those next few weeks like for you? And I know that it was almost 9 years ago, but I imagine it's still very much fresh
Yes.
in your mind.
It is again like it was yesterday. I think one of the things that helped me, I mean, first of all, that first night, because it happened, I was diagnosed kind of towards the end of the day. So there wasn't a lot that I could do. And it was a Friday, of course. So I was a little bit subject to the timeline of being in a weekend of just kind of overwhelming fact that I had this cancer diagnosis. And I didn't really know what that meant. I knew nothing about breast cancer at that point in time. I didn't really know a lot about cancer in general, if I'm being honest. So I was really stuck in this hole for a minute. But the one thing that really helped me was the center that diagnosed me. They gave me a nurse coordinator as a contact. And honestly, that was the biggest help. And she actually took a call with me over the weekend and just explained everything because I was really nervous to kind of go down the Google rabbit hole. Of course, I did a little bit of that. I'm not going to lie and say that I didn't because I just didn't know any information. And when you're in that moment and you're so paralyzed, all you're seeking is
Yeah.
something, some kind of information to wrap your head around it. So I did do that. It was scary. It was intimidating. And then when I talked to a nurse coordinator, and also I started talking to a few people that were survivors as well over that course of that weekend. I talked to the nurse and then I talked to survivors. And I gathered so much more information around what I was facing and just what our potential like plans and how this was all going to go. And that really helped me be able to wrap my head around what the next steps were, because I think that's the paralyzing factor is you just have no idea what you're dealing with when it's just said you had cancer and there's not a lot of other information given to you. So I think those couple of things over that course of that weekend helped. And moving into the next following weeks, just being able to talk to more people who have had a similar experience and kind of laid out the groundwork of here's who you're going to call, here's who you're going to talk to, and starting to really gather more information. That was just really helpful to me as being able to understand kind of what the plan was, even though I didn't have a plan, but have some kind of line of sight into what that looked like. I think just gave me some kind of view into it instead of just seeing nothing, which is what I did initially. I saw nothing. I couldn't
Yeah.
comprehend any part of it until I knew those more granular details.
I think it's important. I love that you said, you reached out to people, you met with the navigator, the nurse coordinator, and a
Mhm.
lot of places have these resources available.
Yeah.
And I urge people to ask, if they can be really, really helpful. What did your treatment plan consist of?
So my tumors, I had two different tumors on my right hand side, and they were both relatively smaller. So because of that fact, I initially went through with like a mammogram and then an MRI to kind of gather all of the information in that initial phase because they needed to kind of figure out what those first steps were. And after that, it was really going forward with looking for a breast surgeon because my first line of treatment was a surgery. And I was offered a lumpectomy or a double mastectomy, and I chose to go with the double mastectomy because I wanted to be more aggressive. And I also something that somebody said that really helped me kind of wrap my head around this too. It was a survivor that I talked to that I will never forget, but she was like, you will know every time you look in the mirror with a mastectomy like that happened. You'll have that in your reflection for the rest of your life, but it also matters what you want ultimately, not only from like aggressive treatment or how you want to feel in terms of like mentally, but also physically. And for me, knowing how I was, before what my original boobs look like versus now, after talking to surgeons, I decided that a mastectomy was going to not only get me the results mentally and make me feel the safest, but it was also making me feel better with how it was going to look when I was done with everything. Because I was really small chested, so a lumpectomy would have deformed me on one side. I also was probably not going to be able to keep my nipple on one side because the tumor was so close and margins need to be clean. So asking all of these questions to not only think about like what was right in the moment and what was going to make me feel good in terms of the treatment that was right in front of me. But also years later, I wanted to still feel confident and good about the outcome I was going to see physically, because that is such a hard part around breast cancer too. There's so many like factors that come into it years later, even, you're kind of subject to all of those decisions. So that was my first line of treatment. And one thing I think that's really helpful and I get asked a lot about was like, did you go with your first surgeon that you talked to? No. I actually interviewed like five different breast surgeons before I decided on the one that I was going with. And I strongly recommend that to people because I feel like you just want to make sure that you're feeling what you need in that scenario. And I kind of equate it to dating. I feel like you go on this journey where you're like, do I connect with you? Are we on the same page? Do we feel like we, align on how I need to be treated, how they need to be treated, how we both need to combine in a team? So that was also part of my initial kind of part of my treatment was figuring out who my breast surgeon was and then going through with that double mastectomy. So that all happened within the first two, maybe, oh gosh, months. Yeah. I was diagnosed in like mid-October and then I had my mastectomy in mid-November.
I love what you said about both things really short term, long term, not staying with the first person that you maybe meet. And I think that there is with anything when we get shocking news, there's this impetus, all right, we gotta act on this immediately.
Yeah.
And in most cases, you have some time. You don't have months, but you have a few weeks.
Right.
Again, there always are going to be situations. But I think thinking about how am I going to feel in the short term, but also what's important to me in the long term, and making
Mhm.
sure you go with a team that feels good for you. And that looks different for everyone. And the other part, I always like to make this point is that even if maybe you went with a team initially that ended up not being right for you later, you can always transition, right? You're
Yes.
never stuck
Yeah.
with the same people because things change, priorities change, discussions change, everything can look different in a couple of years.
Absolutely. And what you need in those moments can feel different too. So I totally agree with that and have my own experience with it. So I think that that definitely matters. And I love that point is that you don't have to stay with that team just because you feel like obligated to. You definitely have the agency as
Mhm.
the patient to be able to get what you need and want.
After chemo, what happened next? I mean, sorry, after surgery, what happened next?
So I did my double mastectomy, went through the full 8 weeks of recovery, physical therapy. Physical therapy is 100%. I feel like that was something I tell everyone because they're like, how did you get your range of motion? It's so amazing. I'm like, physical therapy, and you do those exercises as much as they tell you to do them. Because I was determined to get that mobility back. I'm a dancer. I've been a dancer my whole life. And that was something that was so incredibly important to me. So that was my kind of recovery period. And then from there, they tested the tumors because I was estrogen positive and HER2 negative. So those went to the tumor board and I got an oncotype score. And they did an oncotype score on both of my tumors. And noting that because I was only 30 at this diagnosis, where my scores fell on that spectrum, that required chemo. So I did go into chemotherapy for 6 months. I did 8 rounds, so one round every 3 weeks. And yeah, that was kind of like my course of treatment. I did a chemotherapy called CMF, which is not typically as well known, I think, in the cancer, well, in breast cancer community, because it depends on where you're at in terms of staging and whatnot. But where I was able to do that form of chemotherapy. It is intravenous, but I did not need to have a port. And my vein hung on, which was, whew, I was so grateful for that because I was like, please, please just hold on, vein. And it did. So I did that over 6 months. And then after that, I did my reconstruction. So the whole time during chemotherapy, I had what they call as expanders in to expand the breast pocket and get it ready for a silicone implant, which is what I have now.
CMF chemo, we again, and I think an important point here is, and I think you had mentioned this actually on your social media at one point, is, everyone's chemo decisions are different. And yours was also 9 years ago, which we use different things now. And
Yeah, of
CMF
course.
remains a really good viable option. I think we sometimes use it more in older patients because there's a
Mhm.
little bit less side effects, but there are going to be nuances. And I think one of the points I always like to make is that everyone's treatment decision is so individualized that
Yes.
I'm sure you've had people say, why'd you get this one? And I got this.
Mhm.
And I think
Mhm.
just really having a team that you can bring this to and say, why are we picking my regimen for me? Uh,
Yeah.
did you have a conversation about fertility?
I did. So that was an interesting whirlwind because I don't think I was prepared for that if I'm like very, very transparent. no one really talked to me about it until it was needed to make a decision within 24 hours. And that was really a wild, I remember I was just uncontrollably crying in that whole appointment because I wasn't really sure if I needed to have chemo. It was, to your point, very individualized to what my diagnosis was and what my oncotype scores came back as. So again, this is like it's so nuanced, which is crazy. But so I was told that I needed to do chemotherapy. And in that same appointment, my oncologist asked me, do you want to have children? And at this time, I was 30 years old. I was not in a stable relationship. I was like, I don't know. I don't know. This is such a big question to be asked. But ultimately, after talking it through and kind of having the time to digest it very shortly, because I did have to decide that within 24 hours, I did want to ensure that I had the option to do that whenever I was ready to make that decision. So, it wasn't quite as discussed as early as I wish it had been. But I did, since I had to decide that so quickly, I think it was just kind of a, all right, gut decision. We're just going to go through with this to make sure that we have the insurance of having eggs frozen. And hopefully, if I want to use them in the future, great. If I don't, then at least I had that as the option. So I did do two different rounds of IVF egg retrieval before I went through chemo. And that was like that's a story for a different time, I think, because it's a wild ride in terms of all the things I had to go through because it was over Christmas as well. So as you can imagine, that was just a lot.
And I think that what you went through and having to make that decision so quickly is so challenging for so many people, and it happens that way for so many people. But how are you expected? And I always wonder when we tell people this, right? We're like, well, we need to know by tomorrow. How are
Yeah.
you expected to make such a change, big decision? And I think the cost of it, and then there's always fear
Mm.
about sometimes patients worry, well, what if I do it? I have to postpone my treatment for a few weeks. And we generally feel very comfortable with waiting a few weeks. But I
Yeah.
think that those are really nerve-wracking. There was this fascinating study where they actually showed that when they surveyed patients about where you talk to about fertility, about 50% of patients with all kinds of cancers said they did not have the fertility conversation, which is
Wow.
shocking. And I
That
think it
is.
reinforces having that conversation as early as possible and more than once, you know,
Yeah,
and
agreed.
sometimes it can be hard. I think these are also really hard topics to think about right now. You have to focus on cancer and fertility and what am I going to do with future family planning. It can be really emotionally, I think, also just hard, super hard.
Yeah, no, absolutely agree with all that. And that's shocking. I didn't know that statistic. It's
Yeah.
wild to know it. And also, it is to your point with like the concern, because I did have to kind of move my treatment a little bit back because I had needed to do two rounds versus just one because I didn't get enough the first time. And there's also this concern swirling in my head being a reproductive cancer patient at the time of like, are these hormones going to be doing something bad? Or, all of that stuff just kind of swirls at one time. And you're right, you want to be in a survival focused mindset. So trying to think futuristically around fertility and what that could do for your future and things like that, it's just not really as prioritized as, you're going into treatment and trying to do all the things to
Yeah.
help your health get better and heal. So
Yeah.
that is definitely not something.
Hard decisions.
Mm,
So chemo, reconstruction.
yeah.
What about endocrine therapy? You had a hormone receptor positive cancer.
Yep. Yep. So all through chemo, I did Lupron shots, which shut down my ovaries. And to be honest, I always laughed and joked at my mom when she would say she was getting a hot flash. And I was like, that's not real. That's so not real. Like, you're being so dramatic. And then when I started getting hot flashes, I was like, she was not dramatic. That is real and they are intense. So Lupron was my first kind of hormonal endocrine therapy introduction, if you will. And then after reconstruction, starting right after, actually, kind of into my recovery period, I started tamoxifen and was told that I was going to be on tamoxifen for 10 years as my form of endocrine therapy moving forward. So, yeah.
How's tamoxifen been?
Well,
Where do we start?
yeah, I'm like, where do I start with that? Honestly, the first 5 years, I had pretty manageable symptoms. I did feel kind of the more creaky joints and a little bit more fatigue. And it was definitely harder to manage weight in a lot of ways. But I didn't feel necessarily so bogged down by it until year 5 when I think things started just transitioning for me. And this could be a lot about like my age and getting kind of closer to the perimenopausal phase. There's so many different nuances to this. So to say my experience is just my experience, I can't speak for everyone. But 5 years into it, I started feeling a lot more joint pain, a lot more brain fog and fatigue, and just this underlying like physical kind of almost chemical anxiety, which was so strange for me. It's not something that I experience. I have anxiety in general, but like the chemical kind of feeling where it almost feels a little buzzy inside, that I didn't feel prior. So at year 5 and going forward, I was just kind of like, how do I do this? How do I manage this? Because it was a lot and it continued to be a lot for a bit of time until I figured out some more management techniques. But tamoxifan's hard. It is a rough, it can be a rough drug. It can be manageable. And the other thing that I did notice, which I kind of forget about, but it all kind of, again, brain fog. I forget things very easily. But I had periods originally, and they were pretty regular, I would say. And then I think after year probably 4, I was on tamoxifen, they started getting further and further and further apart. And then year 5, they went away completely. So that was also something that I think potentially contributed to some of the side effects that I was feeling. But that was an interesting note because I remember being like, is this normal? What's happening? My periods are just kind of being way more irregular than I've ever experienced in my life. And yeah, that's kind of how it all has transpired for me so far.
Well, I want to make 2 points of what you said. So I think you said you did Lupron during chemo, and this is really important. Lupron can be used, or Zoladex, one of those medications can be used to shut down your ovaries for chemo. One, it can help increase the chance of a natural pregnancy in the future. But another reason, and we're really starting to do this more often now, is can we preserve menstrual function? And there's actually going
Mhm.
to be a clinical trial, I think, looking at this, but we know that chemotherapy can damage the ovaries, can age the ovaries. So let's say you're 30, you're going to need 10 years of endocrine therapy, you're going to be done and be 40. Um, your ovaries, we don't want your ovaries to be 50 when you're done. You want them to still stay at
Right.
40. So by kind of not allowing the chemo to get to them, it can preserve ovarian function, maybe allow you to not go into early menopause as we often see with cancer treatment. And to your other point, how initially tamoxifen was okay and then started causing it. And a lot of that actually has to do with you're probably, for other people, you may be in perimenopause and the hormone
Right.
changes are doing this fun, up and down
Mhm.
thing. And so I see this often in patients who are fine, fine, fine on tamoxifen. And then all of a sudden everything kind of go, wait, what's going on? And that's the
Yeah.
hormones that are wreaking havoc. Tamoxifen does not put you into menopause, but it can cause all those hormone fluctuations and cause changes in your period.
Yep. That is, yep,
Mhm.
exactly what I
Yeah.
experienced. It was a really weird wall that you hit at that point, but it
Mhm.
definitely felt, yeah, I guess the bell curve was just a little bit different for me. So,
And now being almost 9 years out, right, and having spent your 30s as a breast cancer survivor, I mean, I know that emotions are up and down for everyone, but tell me some thoughts that you have. I know you talk about this a lot, and we often say, right, active treatment doesn't end when chemo ends.
yeah.
Tell me,
Yeah.
talk to me.
So I feel this is where I actually like bringing this up because I feel like when you're a cancer survivor or you're a cancer patient, I don't, I can't speak it for it being collective in this way, but I do feel like when you think of healing and when you think of survivorship, it's kind of feels a little bit linear in your head, but this is a perfect point of how it's not linear and how there's no right or wrong way, or there's no timeline for when you begin healing in a certain way. Because I do feel like when I ended, active treatments, and I use air quotes because we still go through treatments even after that with like tamoxifen and all things we just talked about. But I had this kind of period in time, I think for the first few years after like chemo and surgeries and whatnot, that I just kind of like was floating and doing all this stuff that I had this new perspective on life. I was just kind of like, life is amazing and beautiful, which is very true. And I still feel that way very strongly. But I don't think that I had or gave myself the processing opportunity because that's the difference. Like active treatment, you're kind of in the survival mode, and then survivorship is the processing time. And I didn't really start processing fully and deeply probably until about 6 or 7 years out. And that first beginning part, I mean, a lot of this had to do with the timeline of the world and the pandemic happened and things were distracting, which great. But also, I just think until I really sat down and started going through the deeper feelings of survivorship and what the hell did I just go through? And even though it is years ago, it still feels like yesterday. And processing kind of what I feel now in survivorship and all of these things that feel invisible to the world around me. That is definitely kind of it's not linear. It took me this long to kind of get there and start processing the emotions. Some people do it right away. Some people do it years later. Some people don't maybe do it at all. And that's completely their process. So, for me, it took me years to kind of really let them sink in and start to visualize them because I think I didn't really know until I started writing things down. I love writing. I'm a big writing girl. I've been journaling since I was a kid. I've been creative writing since I was a kid. So I think I needed to visualize what I was feeling. And that's when I started like writing things down and being like, what is that? Why do I feel that way? Or how do I kind of feel about all of these things that I'm feeling physically, or the things that people can't see when they say, you look great, but I don't feel great. All of those kind of things that I started to process years after. So, yeah, that's kind of,
I love that you said it took you years to start processing it because that I think is more people's experience than not.
yeah.
You're diagnosed, there's so much to go through. You're just go, go, go. It's fight or flight in a way.
Mhm.
And then the dust kind of settles and you're left with, well, now what? Now what do I do?
Yeah.
And I think everyone processes, at least from what I see, I think everyone processes it in different ways. But I do find that you can't ignore it. It's gonna come back to you
Yeah.
at some point. And the only way, I
Hmm.
always like to say, the only way through is through.
Yep.
You can't, it is a trauma, it is a grief. And this is a good opportunity to talk about sometimes people feel like they're not entitled to their emotions because maybe they didn't need chemotherapy or maybe they
Yes.
didn't need certain treatments, and everyone is entitled to whatever emotions, breast cancer diagnosis, no matter at what stage, changes your life, and
Totally.
in different ways for different people. I love the journaling part.
Yeah.
I think it's sometimes scary to do to put all your thoughts out on paper, but I think putting it
Mhm.
out there also gets them out of your brain.
Yeah, definitely. No, I 100% agree with that. And I feel like I think the note around journaling, because when I talk to some people who don't necessarily journal and they ask
Mhm.
me, what do I do? And how does that help? And I talk about journaling and just writing.
Yeah.
And they're like, I don't know if I can do that. I don't know. I'm not like a good writer. And I'm like, you don't have to be. You do not have to be a writer in any way, shape, or form. You can
Mhm.
just write words. You can
Yeah.
doodle. I draw pictures sometimes because I see it in my head and I just want to write, like, get this visual down on a page. I am not an artist. They're terrible drawings, but it's just getting something out and being able to visualize that. And then I'm able to like look back on it too, which I think is really healing and also shows such a progress. And again, it comes back to the point that healing is not linear and is also not on a timeline. And healing is kind of constant. It's like a constant practice and a constant thing that you're going to do probably for the rest of your life because we're always healing, we're always evolving, we're always growing. But you're able to kind of see how that evolution has come to fruition when you have it written down or when you even if you're just writing words or doodling, that is still completely enough. And that's like more than enough, to be honest. You're doing something to get that out on a page, and eventually that will evolve into something different. So I
Yeah.
try to tell people because I just think it's a really good practice and it's helped me a ton. So
And
yeah.
it can be two words, it can be two
Yeah,
paragraphs. You know, I always like telling people start
exactly.
with right now I am feeling and go, right?
Hmm.
And
Hmm.
sometimes it helps to have something to start with. Sometimes patients or tell me that they are nervous about writing or they're not sure. So I even say dictate into your phone, do a voice note,
That's a good
right?
one.
Do
Yeah, I love
whatever it
that.
is, just to say or write feel your thoughts out loud. Because sometimes I think we all do this. Our fears are maybe sometimes when you put them on paper, you realize, okay, this is what I'm afraid of, but this is how I'm going to attack it, or this is what I'm going to do, right? I think
Yeah.
seeing it maybe
Hmm.
lets it do not take on this big life of its own.
Yeah. And I do, to your point, truly believe that letting it kind of fester inside is never going to be something that aids healing in a way. Like, and everyone's process is different. So it's not to say that there's again, a wrong or a right, but I think just being able to visualize it, even in the most minimalized way, or doing it on your phone. I have a whole page, for example, in some of my journals that say just, I am anxious over and over and over again. And that's all it is. And that's not huge or anything, revolutionary, but it is very visual to see that I was anxious that day. It's very
Mhm.
clear. And just getting that out also helps with that internal energy that you're feeling when you have those
Yeah.
thoughts and feelings too. So, yeah, I don't know.
What has been your experience in talking to others in your life about all of these things? You know, so often family members, friends, they need you to be okay. They want you to be okay. And I hear patients, families tell me all the time, but they're good now. They're done, right? Like we can get back to
Hmm.
our real life. This was
Hmm.
a blip. And we know that that's not what actually happens. But how do you have those conversations and how do you communicate that?
Yeah, I mean, I not only do I try to put out there kind of in social media platforms or other platforms, just educating people in my life in the ways that I do it, which I love writing. So that's kind of my go-to. But when I do have conversations around it, I think it's more just being really honest. I, it's crazy because cancer, even though it comes with so much complexity and so many layers, and there's a lot of negative and a lot of like hard things that come with it. I think the thing that I can say is the hugest positive for me, at least, is it showed me how much validity I have in my honesty. And that is just like, I don't know, it just opened up this whole different level of emotional intelligence for me, I guess is the way I'll put it, is that I'm like, I'm going to be honest. I don't want them to think that this is something that it's not. And I'm also not trying to make other people feel comfortable because that's what they want to feel. I'm not responsible for their emotions and the way that they react. I just need to be honest with what I'm feeling. So trying to educate them, I try to do it in like a very, nice and kind way because that is just how I feel is the best approach for myself. But I think it's also really important for people to understand that the things that you're feeling and the things that they can't see are still real and true and valid. So that's kind of how I approach it. So if friends or family say those things, which they often do, you're done, like you're in remission, that's amazing. They think it's gone and you've reached the finish line. But continuing to tell them, no, I'm still on this treatment. I'm still on tamoxifen. It brings on these kind of these physical side effects, or I'm also healing emotionally. So I'm dealing with all the trauma that I went through now versus, right then, because I didn't have the processing time to do it when I was in active treatment. So just making sure that they're aware that healing is something that is a continuation. It's not something that you just get to like put a gold star on your wall and say you finish or get a trophy for. There's no participation trophy for healing. Healing is something that you do
Mhm.
constantly. So I think just being able to educate them in a way that we're talking like right now, this is how I would talk to them.
And
So
I love that you do that. And I love that you use your platform to be vulnerable and honest and share that because so often if everyone in your life is telling you, oh, you're done, yay, it can make you as the patient feel like I'm doing something wrong. I don't feel done,
Mm,
right? I don't feel
yeah.
good in my body. I'm still having all these side effects, but everyone around me is telling me you should feel great and happy. And I
Yeah.
think sometimes people aren't in the community, and so they are very isolated and dealing with this on their own. So I think really just having these conversations is so important that
Yeah.
someone else can go, okay, yeah, I don't have to, I'm not there, and I
Yeah.
think that it's a process. And it's going to look and feel different for everyone.
That is such a good point because it's so true that we as survivors, we have this pressure to feel grateful, to be grateful. You faced this really crazy, hard, life altering thing. And now you should be grateful. You should be strong. You should be
Yeah.
all of these things that people put that pressure on by saying what you're saying, and that you're done. You did all this, like you're great. You quote unquote beat it, which I don't love that terminology, but people like to feel like there's a completion to things. They like to be able to check that off the list. But then that does create pressure within
Yeah.
the community to feel like they have to perform that strength and perform that gratitude. And gratitude and strength can be true still, but there also can be grief. There also can be trauma. There also can be tough times, frustration, anger, all of those things. They can live in the same place at the same time, and that is you. So I just don't think that there's always like a black and white kind of
Yeah.
way to think about that.
Yeah. I think the duality of emotions that you can be
Yeah.
grateful. Okay, I'm happy. I'm grateful that I'm done with chemo. And I'm really having a hard time and struggling with mental health and physical health. And, you don't have to pick one over the
Yes.
other, right? And I think
Mhm.
just normalizing that you're going to feel different, and different is not necessarily bad, but
Yeah.
it is going to be different. And I think the challenge that I have as an oncologist is how how do I prepare my patients for that? Because it's a lot at the beginning, right? Imagine saying, "Oh, this is 6 months of chemo and then this and this, but it's gonna be with you for a long time." It also feels very daunting. So you want to prepare
Mhm.
people, but you also don't want to overwhelm. And so that's a fine
Yeah.
line, I think, for us in the medical community of how do we prepare patients, but also kind of do one thing at a time.
Yeah. No, that is, I mean, yeah, that's definitely a harder place to be because you are trying to, it is overwhelming. Whenever you're in a medical office, it is overwhelming, especially when you've gone through so much from being a cancer patient and going into survivorship. I think where it helps is just always asking them, like, how are you really feeling in that kind of situation where you're like, this is a safe space. You can talk to me about everything. You don't have to perform strength. You don't have to perform gratitude. I want to actually know how you're feeling in this place and in this time. Because to our earlier part of this conversation, I didn't feel that right away. I didn't feel the need to be like, help me, like I
Yeah,
didn't feel that need to say that to my oncology team and be like, survivorship is a lot because I didn't feel it right away. It took me years to get there.
yeah,
So I don't think it's necessarily every person is going to be on that same timeline because that's just not true. But as a medical professional and being able to just ask us really how we're feeling and constantly giving us the safe place to do that, that is the best case scenario that we could ever ask for is just feeling like we are in a safe place, we're listened to. Because that's something that I think I've faced a lot within my own journey is sometimes I didn't feel listened to by my team. And I was like, okay, they're just making me feel like maybe I'm a little like I'm overthinking this. And that's going to happen in survivorship. Like sometimes people overthink things, or sometimes people, are concerned or scared, and the anxiety bubbles up. And having a team that lets them have that safe space to just talk through it and give them the validity of being like, I hear you. Let's talk through this. I think that's the best thing any
yeah.
provider can do,
I love
honestly.
that. And I want to make the point that maybe, just like you said, right, at one point, maybe you didn't need extra support or you felt like you were okay. That can
Mm.
always change. So I think
Yeah.
it's important to not pigeonhole people. Oh, they're doing great. That means they're always going to be doing great, right? That things
Yep,
change
exactly.
and life situations change and things can bring on other emotions. So really constantly always reevaluating, I think is so important.
Yep, I agree totally. And that's, again, nobody's experience is the same. So it's like, so it's going to be so different for each person.
We could talk all day, but
Yeah,
I
we
think
could.
this was so helpful.
Yeah.
Where is there something we didn't talk about that you want to mention, and where can people connect with you?
Oh gosh, I mean, like you said, we could talk for hours. So I don't even know what another subject is, but I'm sure we can figure it out. So if we want to have another one, we can. But you can find me on social media. I am on Instagram at Dani, Dani underscore Trops, Trops. And I same handle for TikTok as well. And yeah, you can find me there. And I we'll talk a lot about all of the feelings, ups, downs, in betweens, all of it.
Thank you so much for doing this.
Yeah, of course. Thank you for having me.